viewers of Instagram, Dr. Randall Hayworth here, talking to you about two things that we all have on this planet, and those are eyelids. And those eyelids invariably age as we get older. They start to invariably show wrinkles, they can show bags, and they can show tear troughs. But I'm not here to talk about those latter two morphological changes. I'm here to talk to you simply about wrinkles that start to appear when we smile, and they become more and more bothersome. How can we treat those? Well, you can treat it with skincare, Retin-A, etc., and it has some degree of protective effect. Then you can do RF technology, radio frequency, Morpheus 8. I like that, but it's not my first line of treatment because it's not as effective as the next rung of the ladder up. Lasers. You have erbium lasers where you can just do those in the clinic. You'll have to do a number of them. And yes, they're a little bit better, doctor, but they're not as effective as getting those wrinkles removed with a CO2, carbon dioxide laser. However, the healing is prolonged, and the results, could get you maybe 40 to 60% improvement. That's nothing to sneeze at. However, nothing beats the lower lid pinch blepharoplasty, which involves a little precise cut after we pinch the extra skin, which allows us to gauge how much lower eyelid skin we're going to cut out before committing to cutting it out. Because if we pinch and we notice it's a little bit of pull down of the lower eyelid, we modify how much we're going to take out. So we get an immediate servo feedback mechanism before things are too late. We cut that out and then we sew it together. I sew it together with one singular stitch, which comes out in 5 days. It is a beautiful operation, beautiful in its elegance, in its simplicity, in its speed of healing, and its efficacy at reducing lower eyelid wrinkles. About 80% compared to even the strongest of CO2 lasers, which, as I have mentioned, approaches 60%. Thanks for watching. I hope you learned something. Again, remember, believe what you see and not what you watch. Bye-bye.